Today we will discuss about the branches of the external carotid artery. We have already cut the incision of the head neck regions. This is a common carotid, and this common carotid along with the interjugular vein, and there is a one nerve. It is the vagus nerve inside the carotid sheath. The common carotid artery, which is divided into the two branches at the level of the C3 C4, at the level of the thyroid cartilage, upper border of the thyroid cartilage, it divides into the internal carotid and external carotid artery. Internal carotid artery, it does not give any branches inside the head and neck. It directly supplies to the cranium inside the brain. And the external carotid artery, which gives the 8 branches inside the neck region. But in this cadaver, there is some variation. This is the superior thyroid artery. This superior thyroid artery, which is the first branch of the external carotid artery, but here it is a branch of common carotid artery because it coming arise from the before it divide into the external and internal carotid artery. The common carotid artery in this cadaver gives the superior thyroid artery. Superior thyroid artery, which is gives the first branch, it is the supralaryngeal artery, and this supralaryngeal nerve, which is passes along with the internal laryngeal nerve. This internal laryngeal nerve, it is a branch of the superior laryngeal nerve, and superior laryngeal, it is a branch of the uh, vagus nerve. So this extra internal laryngeal, which is also gives the uh, superior laryngeal, it divide into the internal laryngeal and external laryngeal. This internal laryngeal, which is pierced to the thyroid membrane, below to the between the middle constrictor and inferior constrictor level. So this is the inferior constrictor, and inferior constrictor have a further two part. There is a thyropharyngeus and cricopharyngeus, and this is the middle constrictor muscles. So middle constrictor, which is lies above to the uh, internal laryngeal nerve and superior thyroid artery. So here we will discuss right now branches of the external carotid artery. This is a first branch, some variation in this body coming directly from the common carotid. It is the superior thyroid artery, superior laryngeal, and this is the continuation of the superior thyroid artery. And this superior thyroid artery at the apex of the upper lobe of the thyroid gland, it divides into the anterior and posterior. Anterior division, which is anastomosis with the opposite side, and posterior division, which is anastomosis with the inferior thyroid artery. And this uh, superior thyroid artery goes along with the external laryngeal nerve. Here you can see this is the external laryngeal nerve, and this external laryngeal nerve at that level, it pierces to the cricothyroid muscles. This is a cricothyroid muscles, and it is pierced by the external laryngeal nerve. At that level, it is a cricothyroid muscles. So an external laryngeal supplies to the cricothyroid. Another branches of the external carotid artery. Here you can see this artery which is goes inside along with the hypoglossal. It is a lingual artery. Another artery, here you can see this is a third anterior artery. It is the facial artery. You can see here. This is a posterior belly of digastric and styloid muscles deep to it. This is the superior facial artery, and it gives the glandular branches, it gives the submental branches, it gives the ascending palatine branches, and then it goes at the anterior angle of the mandible in front of the masseter muscles, and it enter inside the face, and it gives the inferior labial, superior labial, and then angular branches. So three branches emerging anteriorly. First one is the superior thyroid, second one is the lingual, and third one it is a facial artery. The posteriorly, the external carotid artery, which gives the first branches, it is the occipital artery. The medially, this external carotid artery, it gives the small branches, it is the ascending pharyngeal artery. So this one is the ascending pharyngeal artery, and this is the posteriorly, it gives the occipital artery, and after that it becomes continuous. As the external carotid artery, it gives a very small branch on the back side, This is the, here you can see this is a posterior auricular branch, and after that this external carotid artery inside the parotid gland, it divide into the two branches, maxillary artery and superficial temporal artery, but we have not dissected here. We will not see the terminal both the branches, but here this external carotid artery which is divided into the maxillary and superficial temporal artery. So the branches of external carotid artery, in this cadaver there is a variation. It superior thyroid arises from the common carotid. This is the anteriorly along with the hypoglossal nerve. It is the another artery. It is a lingual artery. This is the another third artery. It is a facial artery, and medially you can see there is a artery which is goes medially aspect. It is the ascending pharyngeal artery. This is the ascending pharyngeal artery, and the posteriorly there is a artery. It is the occipital artery, and the last branch of the external carotid artery, it is a posterior auricular branch on the back side. Two back side, one is occipital and posterior auricular, and the last termination of the external carotid artery, it is the superficial temporal, and there is a maxillary artery. So these are the 8 branches of the external carotid artery. It divide at the C3 C4 level and at the upper border of the thyroid cartilage.